Good afternoon, everybody. Kathy and I are very excited to talk in depth today about the PALS for Life program and also additional program that happens at the Upper Valley Aquatic Center. So go ahead, we'll go ahead and get right into it. Next slide, please. So we just wanted to kick today off with, of course, some testimonials about our program from those who've experienced it. Generally, people have said that they're stronger. They can see what they're certainly capable of now physically, as well as, that they can do some things that friends their ages cannot, how they've improved their range of motion, where their surgery happened, and so much more. And I think by probably the end of this this echo, you will also hear from a few more of our survivors who will be chiming in to give their experiences. Next slide. Kathy, I'm going to have you do this one, all right?
Yep. So the PALS study we did at the University of Pennsylvania, it was breast cancer survivors, 1 to 15 years post-diagnosis. There were 288 people who we recruited. I'll just go down the slide. We did 2-week progressive total body, full body exercise program. We had 3 months, we worked with area YMCAs. So for instance, we had a YMCA in New Jersey that we used, and then the way we recruited was a certain perimeter around that, mileage-wise, around that particular YMCA. To back up a little bit, we actually brought the PAL trial from the University of Minnesota. We never started it there. We brought it to Philly in order to do it, to be honest, because we knew that we would have a zero representation African-American population in Minnesota. And we felt that it was very important. One of the team's interests was also minority health. So we did a 3-month supervised with trainers who were all trained in how to do the PAL trial. And you'll see it's very specific, completely research-based. And then they had 9 months of unsupervised, which during that time, they also had complete access to their trainer, phone, email. The trainers would meet with them if they had any questions. And then they saw me, if they weren't my training group, every 3 months for measurements. So we did a full litany of measurements, surveys, arm circumference, arm volume. Every 3 months we saw every single person in the study. So there were 2 groups, but within those 2 groups, there were 2 groups. So there were 2 groups, intervention. They got the personal training first. So they got a year membership at their area YMCA. And then after that, the control group got a full year membership. They got the same treatment that the intervention group got. Because how can you have cancer survivors come in and be like, no, you're going to be in the control group. We're not going to give you an exercise. So the cool thing was that both groups got the identical thing. It's just that the control group got it after the intervention group. And we continued to see all of those people throughout the full time. So the 2 groups, intervention, control, and within each group, there was those with lymphedema diagnosed as a greater than 10% difference between their 2 arms. And then those at risk for lymphedema, meaning that they didn't have it yet, but every person who has breast cancer, any kind of treatment, any kind of surgery is at risk. So there really are only 2 types of people within the breast cancer world. Those with lymphedema and those at risk. The study measures, we did arm volumetry with every person every 3 months, bioelectrical body fat, circumference we did every 4 centimeters on their arm all the way up. And what we found, so everybody has had a patient or a client who says, never lift more than 10 pounds. So basically what the PAL trial did was it was the first scientifically based random randomly controlled, getting all my big words mixed up, trial that definitely showed that those people that we developed an exercise, full body exercise training program for people who are breast cancer survivors. It was safe for those with lymphedema. Their events, if you will, having to go to the doctor, having to get IVs, went way down during their strength training program. And those at risk, their numbers did not increase. I'm going to give you two very quick examples. We had one woman who fell down, not in the trial. She was out hiking, and she fell down, and she didn't develop. I'm going to back up. We had two people who went out, and they both had ended up with broken wrists, right? One person developed lymphedema, and one person did not develop lymphedema. So what does that tell us? It tells us that it's kind of a crapshoot. However, we also found that the person who didn't develop lymphedema was in the intervention part. So perhaps, I mean, that's research, right? Perhaps the strength training had helped with that. So I'm done with that slide. Erin, do you want to add anything?
Nope, I think we can move on.
Okay.
And so this slide comes from, of course, ACSM. Their exercise is medicine. And we just want to ensure that you've seen it, because it talks all about the health-related outcomes in those with cancer. And that's why I think we're all here. We're all, working to strategize and train you guys to hopefully start up or enhance programs that you're already currently doing. So by looking at this graph, there is strong evidence that, aerobic intensity 3 times a week for 30 minutes per session, and also resistance training 2 times a week, 2 sets of 12 to 15 reps. So that combination does help with cancer-related fatigue. And what's interesting about this slide for us is that after the PAL trial was complete, of course, the PALS for Life program began. And we utilize, even today, these strategies to ensure that what we're doing is effective and that there's controls. Go ahead and let's do the next slide. So again, just getting back to evidence-based guidance and recommendations, we know that for all adults, exercise is important because it lowers 7 common types of cancers. And for cancer survivors, we know that if we help to incorporate exercise, it will improve their survival after diagnosis of both breast, colon, and prostate cancer. We also indicated from ACSM is that exercising during and after cancer treatment improves fatigue, anxiety, depression, physical function, quality of life, and it doesn't exacerbate lymphedema. Next week, you guys will hear from Kathy again, and she will talk all about what we do right now with those who are in treatment and how we're effectively designing cancer exercise programming. So this is all very exciting and gives life to programs like ours here at the Upper Valley Aquatic Center. Go ahead and we'll do the next slide. So what's really important is that I know that there's a lot of different people on this call. The first thing is how to get trained, right? We all have different backgrounds, and I do encourage for everybody to look at, professionally accredited organizations such as ACSM, but also NASM, ACE. There's 5 or 6. And they do offer, also specialty certifications. So after you do a CPT, which stands for Certified Personal Trainer program, you would want to identify and kind of develop your expertise in probably the cancer certifications. And ACSM does provide that, which is great. From there, I've listed Kathy's website, and we can touch base on that a little bit, but there'll be some breast cancer opportunities there. And then I think it's really important to find programs that are near you. And ACSM has a registry we are listed on it here at UVAC for the programs that we do. And in a few weeks, actually, you're going to be hearing from one of the oncologists at the University of Vermont. Her name is Kim Ditas. She runs the Steps to Wellness program. It's something we model here at UVAC. And she's also listed. So there's a lot of wonderful programming that's happening around the world. And this registry will help you identify what might be local to you. So you can kind of resource those who might be doing similar programs. Next slide. So trying to get into the nuts and the bolts of what we do, we of course begin when we meet new individuals who are coming in to do our program here at the Aquatic Center. We have them fill out kind of more of a personal medical questionnaire. We also do the PARQ, which you'll see in a few minutes. But these are some of the basic questions that we ask with a medical questionnaire. You know, what kind of cancer do you have? If you've had reconstruction, have you been you know, baseline measured by therapist, as well as any other comorbidities. We also have them fill out a goal questionnaire because we think it's really imperative that starting from day one, they can, you know, share with us what they're hoping to, you know, accomplish during this next 12 weeks of time. Next slide. This is a letter that we ask, of course, we talk hand in hand here with anybody who refers their patients to us. We send them back with a letter to give their doctor to reinforce kind of what they're going to be experiencing, how frequently, you know, just to set up that line of communication, and that their physician or oncologist or other clinician, perhaps a PT, is kind of just saying to us that there aren't any adaptations needing, or they do have some things that they want us to consider when working with this individual. Next slide. So the PARQ, as I spoke about earlier, is on the right. That's pretty familiar. But the assessment form is another piece or layer of this. And we ask that our individuals who take our programs fill out an assessment form every time they come in. So each time they come in, which is generally twice or 3 times a week, they're going to give us some insight to anything that's changed, or if they've experienced any you know, challenges. And some of them may be specific to surgical, or, you know, if they've had radiation, or it might just be that they went for a hike and they fell down, right? So this is asking them, it's all encompassing. We're trying to get as much information as we can. Next slide. And then we kind of get to this example protocol, and we've just kind of are showing you really in brief what, you know, the PALS for life protocol looks like. We generally start week 1 with, you know, a form of cardiorespiratory. So we want them on the bike, treadmill. We generally are trying to encourage them to utilize machines that doesn't incorporate their arms, right? We like to kind of leave that, leave them in that state up until really week 5, right? And then we have them do lots of range of motion work, stretching. We also look at core, and I'm going to get into this a little bit more in depth in just a minute here. And then you can see that, you know, week 1, we do strength 1 and 2, which is generally an upper and a lower body exercise. But by the second time that they come in, they might be doing strength 1, 2, 3, 4. So we slowly introduce new exercises. And that's a really important piece of what we do. Slow and periodized, if you will. Cool down also includes the cardiorespiratory, and then we go right back into the stretching that they started with. So there's a protocol for the stretching, and we do it both generally before and after. So making the time for that's really important. Next slide. This is just a basic look at a log sheet that we use. We think it's really important for all of our participants to be involved in tracking their data and seeing how they, you know, are able to, you know, the work that they do 1 week and how it bridges them to week 2, 3, and 4. And then over the course of time, they can really see their significant gains. This also helps us to identify when someone's absent, right, or takes time off, that we have a really, you know, specific way of saying, all right, if you missed a week, we're going to start back at the day before. They don't just jump in and progress, right? We again, we look at all these things, and when things come up, if there's changes that happen, we have these logs to historically look back at and share with the PTs that we work with, so they can kind of see the load and the increases that were made and how frequent they were made. So we all can be involved in ensuring, success for our client. Go ahead and next slide. So getting back to the specifics, a warm-up and stretching. So what does that include? We talked about a cardio warm-up, generally something that's getting their heart rate up, and focuses also on increasing body temperature. We look at all aspects of the body. With PALS for Life, it is more specific to lymphatic and breast cancer. So we do a lot with the upper body in terms of chest, shoulders, neck, triceps, neck and triceps. But we also focus on full body, which is quads, hamstrings, calves, and back exercises. And we, improvise based on the equipment that we have in different facilities. Right now I'm teaching virtually, so a lot of my participants are doing things from home. So we created fit kits for them, but outside of them picking up a fit kit, we have to use always, household items and things to kind of get them in, able to do the things that we're hoping in terms of the stretching and also the strength training exercises. Next slide. For the core training, we are heavily focused on anti-extension exercises, which would include things like leg lowering, also hip flexion with neutral spine, which could, an example of that would be slow mountain climbers, anti-rotation, which is, of course, something like a pallet press, as well as anti-lateral flexion, farmer's walks, suitcase carries. So all very functional exercises, but even more importantly, getting people out of course, primarily flexion, which is where we tend to be a majority of the day in a seated position. So we like to do kind of a nice grouping of core exercises, and they are, the starting block for the program. Go ahead, next slide. I will add that in addition to the core, we do include a lot of like glute activation exercises as well for like the glute medius, and that could be targeted training with a band, lateral band walks, triplanar, single touches, and those sort of things. As far as the weight training is concerned, we do a PHA style, which stands for peripheral heart action, where we facilitate going back and forth between an upper body exercise and a lower body exercise, upper body, lower body. But we include all the major muscle groups when it comes to the weight training. And generally, we round out with about 12 exercises that they're doing for their strength training circuit. Next slide. And then we get to the cool down, which of course, again, as I said, we repeat the warm-up stretching sequence, and then we add in some other things, in terms of working to, move lymphatic fluid and just give some general relaxation and rest to the muscles that we just worked. Next slide. So as part of our PALS for Life program, we also incorporate lymphedema training. So we do work with some providers, and we're fortunate to have such a great system here at Dartmouth-Hitchcock. And so we have relationships with those physical therapists, and they come and they provide an hour-long training during week 3 to our new PALS participants. And we help to monitor changes. We do weekly visual comparisons, wrist and forearms. We also can collect monthly measurements if needed. And so we work really hard to just encourage, of course, body awareness, the healthy lifestyle, and all the other factors, skincare and medical checkups that really contribute to this. So that's another thing that we do that I think is really a positive for the program. Next slide. Not anyone has yet asked, but sometimes people do wonder, what does it cost to run a program like this? And this is very basic, but again, please reach out to me on a more personal level if you'd like to talk some of this out. But this is a sample budget, a 12-week program that has 3 people at minimum. Generally we do a 5 maximum, but I have been known to do 10, depending on space here at our facility. You know, trainer pay can be different depending on, education and experience, but payroll costs are part of most people's situation, membership cost to a facility, as well as educational training. We try to provide, of course, educational training for our staff quarterly, if not in addition to what we do on an annual basis. And then you may need to purchase equipment. So this kind of gives you just a quick synopsis that, annually for one, program where you're meeting to 30 to 60 minutes twice a week, 48 weeks out of the year, you're looking at, over $12,000. So it's important to get funding for these programs. Next slide. So we are really fortunate here. Let me just stop. Kathy, did you want to add anything to that? Maybe.
You did a great job.
Right. So moving forward with our additional options here at UVAC, we've kind of created this umbrella of, specifically breast cancer survivorship, but that is evolving to actually include and encompass all cancer survivors. And I can talk about that a little later. But the Bridge program, because, after people had spent 12 weeks with us, they wanted to continue. And in the initial PAL trial, there was a trainer reaching out every 3 months, but we really felt like what was better was to have them keep coming, right? So our Bridge program meets 3 times a week, and we move away from the PAL trial to something a little bit different. Again, all of our models here are based upon, research-based programming. And so the Bridge program meets for 3 weeks and we focus on some different things. The program we use here, of course, comes from the McGee Women's Foundation. And I have a video link that you guys can check out if you're interested. But with our Bridge program, just like with our PALS for Life program, we allow them basically full UVAC membership. We give them both free land and aquatic classes. They can take, 80 to 100 classes a week in addition to their time that they spend with their, lead PALS trainer. We offer free childcare for most of our participants. We have scholarships, but we do have childcare. And if needed, it's really for a modest fee, $2.50 for an hour or so. And then additionally with this program, we add the nutrition component. Right, so we actually have a research cancer scientist that works with us and provides what's called our Eat to Defeat program. And so 2 times a week they come for their strength training, and the third session is fully based for those 12 weeks on nutrition, which is pretty exciting. Next slide. So just to kind of give you a little loop in, what do we talk about each week? Well, we talk about the good, the bad, and the ugly of all carbs, proteins, and fats. And we really think that this is a good opportunity during their second 12 weeks. When they initially come to us, nutrition is certainly a big part of what they need to accomplish, but it's a lot. And so we really look to do this in the second phase, and we get the best results at that point, because now they're already committed. They've created a habit to coming. They have, started to create that support group with those who they're working with in terms of their training as well as their coaches. And they're really just in a better place to receive some of this information. Next slide. So this is kind of what our Bridge programming log looks like. We do more posture exercises than we do in the PALS life program. We do a tremendous amount of flexibility. And we, we do follow, I actually do continue to do the vertical loading, especially with breast cancer survivors. So we kind of do the upper body, lower body continuum. So next slide. So trying to keep this as brief as I can in some ways. We then, of course, in our umbrella have what's called our Living Beyond Cancer program. And this program is based upon the Steps to Wellness program, which I mentioned earlier. And this is kind of our, if you will, the first 2 programs So 6 months of their time, the first 12 weeks are free. The second 12 weeks, they just pay $49. So really, at this point, once they join our Living Beyond Cancer group, we're needing to kind of move on from the grant funding piece and look at sustainability and say, all right, what can we do here? So they do, we scholarship a certain percentage of this, but generally, if you're an individual who wants to participate, you're paying $55 a month. And that gets you those 2 training sessions with one of our coaches, but also full access to the facility. So I think it's been well received in terms of the economics of it. I think our participants seem to value it, and for those who have financial difficulty, of course, we can go back into our grant dollars and dip, if you will, to try to support those who want to continue onward or who are having financial hardship. And so again, this really isn't a 12-week, it's an ongoing program for us at this point, meaning it's annual, although sometimes we do take time off during the summer. But I've attached the link so you can kind of check it out and kind of prepare for when Kim comes in a few weeks to share. But like this program with all of our own others, we require physical therapy consults, and we really work to just generally improve balance and range of motion, as well as, look at their aerobic resistance and also their flexibility training. Next slide. This here, not really off topic, but back a few weeks ago, we had a presenter. Her name was Maureen Standard. Some of you may remember. And Maureen presented on cardiac respiratory fitness in patients that have been diagnosed with cancer. And we had a lot of interest from you all about baseline questionnaires that could be used to gather information, such as, how much exercise is a patient getting and why are they doing it? Are they, is what they're doing, are they getting what they want out of it? So rather than just asking random questions, we wanted to provide you, of course, with a few other options, validated surveys that go beyond kind of an IPAC and an EMI2. So those we've listed for you. We had a lot of questions about that, and we wanted to make sure to get that information out to you. Next slide. So we've listed references here to support kind of all that we've talked about today. And I guess, Kathy, I'm going to just have you jump in if you have some things to add at this point, and then we'll turn it over to questions.
Yeah. There are a couple, there's one editorial that you can find, and I think it was in the New England Journal of Medicine when the study was first published. That is I find to be a good handout for people because it's really short. It literally is an editorial. Nobody likes to read a research study. So that might be something if you just Google, if you just find the New England Journal of Medicine article, which is noted on here, then you can find the editorials.